If you are over 70 years old and you do this one thing at night, you could be dramatically increasing your risk of having a stroke, and you probably have no idea. Neurologists and stroke specialists are raising alarms about a common nighttime habit that millions of seniors practice every single evening, believing it is either harmless or even healthy. But the latest research tells a very different story. What happens to your brain and your blood vessels while you sleep matters far more than most people realize, and tonight could be the night you start protecting yourself. Please stay with me, because what you learn in this video could be absolutely life-changing. Picture this scenario. It is around 9 or 10 at night. You have had dinner a couple of hours ago, maybe watched some television, and now you are getting ready for bed. You take your medications, brush your teeth, and climb into bed. But before you turn off the light, you grab your phone or your tablet and start scrolling. Maybe you check the news, look at social media, or read a few articles. An hour goes by, then two. Before you know it, it is past midnight, and you have been staring at a bright screen in a dark room for hours. You finally fall asleep, but your sleep is restless. You wake up several times during the night, and when morning comes, you feel like you barely slept at all. This pattern, which sleep researchers call revenge bedtime procrastination combined with excessive blue light exposure, is far more dangerous than most seniors realize. But the nighttime habit I want to focus on today goes even deeper than screen time. It is about a pattern of nighttime behavior that directly affects your blood pressure, your blood oxygen levels, and the health of the blood vessels in your brain. I am Dr. Charles Anderson, and I specialize in helping seniors understand the health risks that often go unnoticed until it is too late. Today, I am going to reveal the specific nighttime habit that neurologists are warning about, explain the science behind why it raises stroke risk, share the warning signs that your brain might already be affected, and give you a clear, practical plan for protecting yourself starting tonight. The nighttime habit that is silently raising stroke risk in seniors over 70 is something that many of you will immediately recognize. It is the habit of sleeping with your head and neck in a position that restricts blood flow to your brain, often combined with untreated or unrecognized sleep apnea, and compounded by eating large, heavy meals late at night. These three factors together create what neurologists describe as a perfect storm for stroke risk during the nighttime hours. Let me explain each one and why they are so dangerous. Let us start with sleep position, because this is something that every single person can address tonight. The way you position your head and neck during sleep directly affects blood flow through your carotid arteries and vertebral arteries, which are the main blood vessels that supply your brain. When you sleep with too many pillows propping your head up at a sharp angle, or when you twist your neck to one side for extended periods, you can partially compress these critical arteries. In a young person with healthy, flexible blood vessels, this temporary compression is usually not a problem. But in seniors over 70, these arteries are often already narrowed by years of plaque buildup. Even a small amount of additional compression from an awkward sleeping position can reduce blood flow to the brain enough to create a dangerous situation. Neurologists have documented cases where stroke events were directly linked to sleeping positions that compromised blood flow to the brain, and they are now paying much more attention to this often overlooked risk factor. The ideal sleeping position for brain health, according to neurologists and sleep specialists, is on your side, particularly your left side, with your head and neck in a neutral alignment. This means your spine, neck, and head should form a relatively straight line, not bent or twisted. Your pillow should be thick enough to fill the gap between your shoulder and your ear, but not so thick that it pushes your head up at a steep angle. Sleeping on your back is generally acceptable as well, but you should use a pillow that supports the natural curve of your neck without pushing your chin down toward your chest, which can restrict the airway and contribute to sleep apnea. The one position that neurologists are most concerned about is sleeping on your stomach. This position forces you to turn your head to one side for extended periods, which can compress the vertebral arteries and reduce blood flow to the back of the brain, where the areas responsible for vision, balance, and coordination are located. But the real danger begins when poor sleep position is combined with sleep apnea, and this is where things get truly serious. Obstructive sleep apnea is a condition in which the soft tissues in the back of your throat collapse during sleep, blocking your airway and causing you to stop breathing repeatedly throughout the night. Each time you stop breathing, your blood oxygen levels drop, and your body goes into a state of stress. Your blood pressure spikes, your heart rate increases, and inflammation surges throughout your blood vessels. Over time, this repeated cycle of oxygen deprivation and stress response does enormous damage to the blood vessels in your brain, making them more prone to blockage and rupture, which are the two main causes of stroke. Here is what is truly alarming. Studies show that up to 60% of adults over 70 have some degree of sleep apnea, and the vast majority of them are completely undiagnosed. Many seniors do not fit the typical profile of a sleep apnea patient that most people imagine, which is a younger, overweight man who snores loudly. Sleep apnea in older adults, and particularly in older women, often presents differently. The snoring may be quieter, or it may not be present at all. Instead, the main symptoms might be frequent nighttime awakenings, morning headaches, daytime fatigue, difficulty concentrating, and memory problems. If you or your partner have noticed that you stop breathing during sleep, gasp, or choke during the night, or snore regularly, you should absolutely be evaluated for sleep apnea. But even if you do not have these obvious symptoms, if you are over 70 and experiencing unexplained fatigue, brain fog, or morning headaches, sleep apnea should be on the list of possible causes. The link between sleep apnea and stroke is one of the most well-established connections in sleep medicine. A major study that followed thousands of patients over several years found that people with moderate to severe sleep apnea had roughly 3 times the risk of having a stroke compared to people without sleep apnea. And here is the part that many people do not know. The damage that sleep apnea does to your blood vessels happens silently, night after night, year after year. By the time symptoms become obvious, significant damage may already have been done. That is why neurologists are so passionate about getting seniors screened for this condition. Treatment with a CPAP machine or other devices can dramatically reduce stroke risk by keeping the airway open, maintaining healthy oxygen levels, and preventing those dangerous blood pressure spikes during the night. Now let me talk about the third piece of this nighttime puzzle, which is eating late at night. Many seniors develop a habit of having their largest meal in the evening, or they snack throughout the evening hours right up until bedtime. While this might seem harmless, eating a large or heavy meal within 2 to 3 hours of going to bed has several effects that can increase stroke risk. First, it raises your blood sugar levels during the night. Elevated blood sugar damages blood vessels over time and promotes plaque buildup. Second, a full stomach can worsen acid reflux, which can disrupt sleep and contribute to inflammation. Third, and perhaps most importantly, eating late at night has been shown to raise blood pressure during the nighttime hours. Normally, your blood pressure should drop by about 10 to 20% during sleep, a phenomenon called nocturnal dipping. This dip is your cardiovascular system's chance to rest and recover. But in people who eat late at night, this dip is often blunted or absent entirely. These non-dippers, as cardiologists call them, have significantly higher rates of stroke and other cardiovascular events. The combination of high nighttime blood pressure with the oxygen desaturation from sleep apnea and the reduced blood flow from poor sleeping position creates a level of risk that neurologists say is simply too high to ignore. And the warning signs might surprise you. Many people think that strokes always happen suddenly and dramatically, and while that can certainly be the case, many strokes in seniors are preceded by warning signs that are easy to miss. These warning signs often occur at night or first thing in the morning, precisely because that is when the risk factors we have been discussing are at their peak. The first warning sign to watch for is waking up with a severe headache, especially one that is different from your usual headaches. A sudden, intense headache upon waking could be a sign of elevated blood pressure during the night or even a small bleed in the brain. The second warning sign is waking up with numbness or weakness on one side of your body, even if it goes away quickly. This could be a transient ischemic attack, often called a mini-stroke, which is a temporary blockage of blood flow to the brain. Mini-strokes are serious because they are often a warning that a full stroke is coming. The third warning sign is waking up with confusion, difficulty speaking, or trouble understanding what people are saying to you. These cognitive symptoms can be subtle, and you might attribute them to being groggy or not having had your coffee yet, but they deserve attention. The fourth sign is sudden vision problems upon waking, such as blurry vision, double vision, or loss of vision in one eye. And the fifth sign is unexplained dizziness or loss of balance first thing in the morning. If you experience any of these symptoms, especially if they come on suddenly, please seek medical attention immediately. When it comes to stroke, every minute matters. Now let me share the practical steps you can take to protect yourself, starting tonight. The first step is to optimize your sleeping position. If you typically sleep on your stomach, work on transitioning to side sleeping. You can place a body pillow along your back to help prevent you from rolling onto your stomach during the night. Make sure your pillow keeps your head and neck in a neutral position, neither too high nor too low. If you sleep on your back, use a pillow that supports the natural curve of your neck. There are specially designed pillows for this purpose, but even a regular pillow of the right thickness can work. The key is to keep your head, neck, and spine in alignment and avoid any position that could compress the arteries supplying blood to your brain. The second step is to get evaluated for sleep apnea if you have not already. Talk to your doctor about a sleep study, which can be done either in a sleep lab or at home with a portable monitoring device. If you are diagnosed with sleep apnea, commit to using your treatment consistently. Modern CPAP machines are much quieter and more comfortable than the older models, and there are also dental devices and other alternatives for people who cannot tolerate CPAP. The important thing is to address the problem rather than ignoring it, because every night of untreated sleep apnea is another night of damage to your brain's blood vessels. The third step is to change your evening eating habits. Try to have your last meal at least 3 hours before bedtime. If you are hungry in the evening, opt for a light snack rather than a full meal. Avoid foods that are high in sodium, sugar, and saturated fat in the evening, as these can contribute to elevated nighttime blood pressure. A small portion of nuts, a piece of fruit, or a cup of herbal tea can satisfy evening hunger without putting your cardiovascular system at risk. The fourth step is to address your nighttime blood pressure. If you have high blood pressure, ask your doctor about monitoring your blood pressure at different times of the day, including in the evening and first thing in the morning. As I mentioned in a previous video, some research suggests that taking blood pressure medication at night rather than in the morning may be more effective at controlling that dangerous nighttime blood pressure surge. But again, never change your medication timing without consulting your doctor first. The fifth step is to create a bedtime routine that promotes restful, restorative sleep. This means turning off electronic screens at least 1 hour before bed, keeping your bedroom cool, dark, and quiet, avoiding caffeine after noon, and going to bed at the same time every night. Good sleep hygiene is not just about feeling rested the next day. It is about giving your brain and cardiovascular system the recovery time they need to stay healthy and resilient. The sixth step, and this one is often overlooked, is to stay well hydrated during the evening hours, but not so much that you are getting up multiple times during the night to use the bathroom. Dehydration during the night can make your blood thicker and more prone to clotting, which increases stroke risk. On the other hand, getting up multiple times during the night disrupts your sleep architecture and can contribute to the blood pressure fluctuations that increase risk. The balance is to drink enough during the day so that you are well hydrated by evening, and then have a small glass of water before bed without overdoing it. I also want to mention the role of alcohol, because many seniors enjoy a glass of wine or a drink in the evening. While moderate alcohol consumption has sometimes been associated with heart health benefits, the picture is more nuanced when it comes to stroke risk. Alcohol can raise blood pressure, disrupt sleep quality, and increase the risk of atrial fibrillation, which is a heart rhythm disorder that significantly increases stroke risk. If you drink alcohol, try to limit it to 1 drink per day and avoid drinking within 2 to 3 hours of bedtime. If you have atrial fibrillation or other heart rhythm problems, talk to your doctor about whether any amount of alcohol is safe for you. Let me also talk about something that is incredibly important and not discussed nearly enough, which is the emotional and mental health component of nighttime stroke risk. Chronic stress, anxiety, and depression all raise cortisol levels and keep your body in a state of heightened stress, which raises blood pressure and damages blood vessels over time. Many seniors experience increased anxiety at night when the distractions of the day fade and worries come to the forefront. If you find that you are lying in bed feeling anxious or stressed most nights, this is not just an emotional problem. It is a physiological one that affects your stroke risk. Consider talking to your doctor about strategies for managing nighttime anxiety, whether that involves relaxation techniques, therapy, medication, or a combination of approaches. Your mental health is just as important as your physical health when it comes to protecting your brain. One more factor that I want to bring to your attention is the temperature of your bedroom. Research has shown that sleeping in a room that is too warm or too cold can affect your blood pressure and sleep quality. Extremely cold temperatures can cause blood vessels to constrict, raising blood pressure, while extremely warm temperatures can lead to restless sleep and dehydration. Most sleep experts recommend keeping your bedroom between 65 and 68 degrees Fahrenheit, or about 18 to 20 degrees Celsius. This temperature range promotes deep, restorative sleep and helps keep your blood pressure stable throughout the night. Before I wrap up, there is one more critical topic I want to address, and that is the connection between atrial fibrillation and nighttime stroke risk. Atrial fibrillation, commonly called AFib, is an irregular heart rhythm that becomes increasingly common with age. By the time you reach 70, your risk of having AFib is significantly elevated. What makes AFib so dangerous in the context of stroke is that the irregular heartbeat allows blood to pool in the chambers of the heart, where it can form clots. If one of those clots breaks loose and travels to the brain, it causes an embolic stroke, which is often severe and debilitating. The troubling thing is that many people have AFib without knowing it. It can come and go intermittently, a form called paroxysmal AFib, and it often occurs during sleep when you are not aware of it. Some people feel palpitations, a fluttering sensation in the chest, or shortness of breath, but many others have no symptoms at all. If you are over 70, consider asking your doctor about screening for AFib. There are now wearable devices and smartwatches that can detect irregular heart rhythms, and your doctor can also order a Holter monitor, which is a small device you wear for 24 to 48 hours that records your heart rhythm continuously. If AFib is detected, your doctor can prescribe blood-thinning medications that dramatically reduce the risk of stroke. This is one of those situations where early detection can truly be life-saving. I also want to emphasize the importance of recognizing the signs of stroke and acting fast. The acronym to remember is FAST. F stands for face drooping. Ask the person to smile and see if one side of the face droops. A stands for arm weakness. Ask the person to raise both arms and see if one arm drifts downward. S stands for speech difficulty. Ask the person to repeat a simple sentence and listen for slurred or strange speech. T stands for time to call emergency services. If you observe any of these signs, call for help immediately. Do not wait to see if the symptoms go away. Do not try to drive yourself to the hospital. Call emergency services because they can begin treatment on the way and alert the hospital to have the stroke team ready. The treatments available for stroke today are remarkably effective, but they are extremely time-sensitive. The sooner treatment begins, the more brain tissue can be saved, and the better the outcome will be. Let me bring everything together with a summary of what we have covered today. The nighttime hours are a critical period for stroke risk, especially for seniors over 70. Poor sleeping position can restrict blood flow to the brain. Undiagnosed sleep apnea can cause repeated drops in oxygen levels and spikes in blood pressure. Late-night eating can prevent the healthy nighttime blood pressure dip that your cardiovascular system needs. And the combination of these factors creates a level of risk that neurologists find deeply concerning. The good news is that every single one of these risk factors is modifiable. You can change your sleep position. You can get tested and treated for sleep apnea. You can adjust your eating habits. You can work with your doctor to optimize your nighttime blood pressure. And you can create a bedtime routine that supports healthy, restorative sleep. Your brain is the most precious organ in your body. It holds your memories, your personality, your ability to think and reason and love and connect with the people around you. Protecting it from stroke is one of the most important things you can do for yourself and for the people who care about you. The steps we discussed today are not complicated or expensive. They are simple changes that anyone can make, starting tonight. If this video has helped you understand the connection between your nighttime habits and your stroke risk, I would be so grateful if you would hit that subscribe button. Every time you subscribe, it helps this channel reach more seniors who need this information. Turn on notifications so you never miss a new video, and please share this with anyone you know who is over 70, because this information is too important to keep to yourself. Thank you so much for watching. Take care of yourself tonight and every night, and I will see you in the next video.